So I'm going to talk to you guys about today about the complications of diabetes. How is it that people die of diabetes more? And why is it that that happens? And then why is it that people with COVID-19 die of diabetes more? So I'm going to break it down for you so you really understand if you have diabetes right now, if you know somebody who has diabetes, nothing has really changed with the COVID-19. It's just another reason for people to actually get stressed, their system to get stressed with an illness, and then that illness puts stress on the system, and then if the system is already being pressured by diabetes, then it's not something that's gonna really help the system. A way to think about it is that if you're going up a hill and you got a truck and you got a nice truck here like the one I'm drawing. This is the next version model right here of the trucks. And if you have a full load right here already, and even a little more, right? And you're trying to go up the hill and your truck can barely make it. Your truck can barely make it. Now, let's say that we increase that just a little bit, the hill. Your truck is going to have an even harder time trying to make that hill. And then in top of that, you add weight to it. That's going to be tough. And it's probably not going to make it. Something is going to fall through, right? Especially if your truck is just like barely making it up the hill. If you add something else, it's either going to go backwards or fall down. And this is the same thing with diabetes, because many people have diabetes and the system is already being stressed out. The system is already being stressed out. The complications of it is already causing problems. So it's really important for us to really determine, why this is happening. And in type 2 diabetics, it's already happening. It's just that it's something extra that the body has to deal with. So nothing has really changed. Like if you have type 2 diabetes, the best thing you can do is actually work on your fitness, work on your health, because that's going to increase your chances that you're going to be okay throughout all of this. But not only that, it's going to set you up for success, set you up for feeling better, set you up for actually overcoming this illness and overcoming that illness of type 2 diabetes. I want to share with you a study that was done on people. This is the study right here about the causes of excess mortality in patients with diabetes. What does this mean? They're trying to figure out why is it that patients with type 2 diabetes die sooner. Why is that? And so they reviewed multiple studies, and this is the first study here that shows about 3 to 5 fold, right here, 3 to 5 fold increase on 2 to 3 fold increase on the risk of death, approximately 2 to 3 risk of death. Males about 2.5, females about 3.5. So if you take all the population and you compare them to diabetics are 3 times more likely to die. Now I'm going to share with you, and so there is already an increased risk of death, right? Your mortality is higher if you have diabetes. You're going to die sooner if you have diabetes. I know this is kind of like right in your face, but this is the reality. Like with type 2 diabetes, the bad news is that our mortality is higher. We die younger if we have that disease. The good news is that you can choose not to have that disease, and type 2 diabetes can be reversed for about 86% of the people, can be reversed. And it's even crazy because if you look at this study right here, it doesn't show that it can be reversed. It just shows that that this is an issue with these patients. So this is why there's a big problem, because a lot of these papers don't talk about the reversibility of type 2 diabetes. They just talk about like how you can manage, right? And so even in this study, they showed the other four studies that they kind of reviewed, and they showed that 2.3% increased risk of a risk of all cause mortality, 1.8, 1.5. So in average is about 1.5, 1.15 to 3 times more likely to die of diabetes. The strengths of this study was showing that some of the statistics were pretty strong, and some of the weaknesses show that they should have kind of stratified it in terms of ages, because it really makes a huge difference on age. But overall, we can see that there is about a 3 times more likely death from diabetes. Now, why is that important for us right now in the COVID-19 era? So, how do people die of type 2 diabetes? Is the following. This is how people die from type 2 diabetes. Let's say that you are a young and strong person at the beginning, and then you get type 2 diabetes. And I'm going to put some guns right here, but the guns go away, so we get weaker and weaker. And then what happens is somebody gets diabetes, right? So what happens with diabetes is that you start getting here's our liver, right? Here's our liver, here's our eyes, here is our heart, here is our kidneys. They look like a little bean. um right? Our genital area, and then all of these things, and even our muscles here, right? And so what ends up happening is that the sugar from our diet, from a diet that has increased the amount of sugar over the past 30, 40 years exponentially, the amount of sugar that is in our diets, this sugar actually starts accumulating in our eyes. So is the leading cause of blindness in our muscles. That is called fatty muscle disease. And people who produce beef, they know that this happens, and that's what they call marbled meat. They actually pack the animals with a bunch of corn right before they are killed, to be able to get the highest quality meat. And so, people who produce these animals know this, and we humans don't really know that the sugar accumulates in our muscles. When I talk to this about a lot of people, that a lot of people don't know. I didn't know this. As a physician, they didn't really teach me about the accumulation of glycogen in the muscles and how it damages the muscles. It accumulates in the vessels of the heart, creating heart disease. It accumulates in the liver, create fatty liver disease, which is an epidemic right now in the world, what is called non-alcoholic fatty liver disease. It accumulates in our kidney, giving us the first and the leading cause of kidney disease in the world. It accumulates in our genitals, creating impotence for men, but it's really in the vessels of the genitals, creating erectile dysfunction. um, and it creates peripheral neuropathy. So people get burning in their feet. They start feeling, lose the feeling in their legs, and because they cannot feel anything, they end up having amputations. Is the leading cause of amputations in the world. And then it also accumulates in the brain, in the small and large vessels. So in the small vessels, you start creating small little areas where there is not good blood supply, leading to dementia. Some experts call dementia type 3 diabetes, for good reason. And then, so the things that I mentioned, those are the small vessels, the microvascular. In the body, there is like big vessels and small vessels. So this is the microvascular, and then the macrovascular complications is from the big vessels, and that's in the heart when people die of heart attack, in the brain when people die of strokes. I'm gonna put macro right here, from the big vessels, in the brain when people have strokes, in the heart when people have heart disease, in the legs when people have peripheral neur- um, peripheral vascular disease in the liver, when people have um, fatty liver disease, as I mentioned, but they end up having liver disease and then stroke. And so that's how you die from diabetes. And the main reason is heart disease. Heart disease. How do we test people if they have heart disease? We actually put them on a treadmill, and I don't know if you guys have been in here, on a treadmill, and the treadmill goes, and the person is running in the treadmill, and we actually put an EKG machine to their heart, and then we check in the machine in a computer. Somebody's checking whether their heart can handle the exercise. Why? Because we're stressing the system. That's what is called a stress test. And when people go into inflammatory responses, this is what happens. Their body goes into a stress. The way to think about it is that if you have an irrigation system that has different water hoses, right? And these water hoses are going to the plants, right? These water hoses are going to the plants, and this is the plant right here. Boom, boom, right? If you have even a little bit of plaque in these water hoses, they can get some water in. But what happens if you cut the water, if you do it by half, right? The water is not going to get through because you're stressing the system. From this, that's going to decrease the amount of water that goes into that plant, right? So it's the same with the body. If you stress the person exercising and they got all of these problems already, their kidneys are going to fail easier, their heart is going to fail easier, their muscles are not going to recover as well. And remember, the lungs are muscles, and so their muscles are not going to recover as well. Their eyesight, everything starts failing a lot easier. And so that's why we put people on stress test. And so and so that's why people who have COVID-19, there are actually people who have COVID-19, they're 3 times more likely to pass from the COVID-19 than the general population. So it's really about the same amount, 3 times more likely to die than the general population. So if now the general population is COVID-19 patients, then you're going to have an increased rate of death just from this issue. And so that's why it's so important to focus on the type 2 diabetes, because from that, you actually can decrease the chances of death. And so here's a study that was just published, and it studied coronavirus 19 patients, and it also shows that there is an increased risk of the respiratory infections, the severe respiratory infection from diabetes, and that the complications are more severe. It is interesting, though, that the patients that were studied in Wuhan, China, they did a large study that was also shown in here, and it does show that these patients did not have an abnormal sugar. But that's hard to say whether it was that the patients were not diabetic or they were diabetic. In the last study that I showed you before, the interesting thing is that they showed that even if the people, that this study was weak because it didn't show whether the people were controlled or not and whether their mortality was high or not. What does that mean? That means that if you're going to die of type 2 diabetes, that whether if you have it, does it mean that if you have it controlled is better than not? It probably is, but the problem is that even if you have it controlled with medications, you're still having insulin resistance. And so insulin resistance is the problem. And that problem is caused by hyperinsulinemia, by increased elevated insulin. And that is caused by a lot of glycogen stores, which is sugars in one way or the other, right? But in this study, then it shows, okay, if the patient gets COVID-19 and they have type 2 diabetes, the most important thing is actually, they talk about the isolations, they talk about the hydration, they talk about type 1 diabetics, which you got to be very careful, because they go into coma a lot easier if they go into this severe, if they're in the ICU, not somebody who's just getting the cold, but just like very sick in the ICU. It can throw them into DKA. For those of you who are type 1 diabetics, you know this. For those of you who don't, is that the body has their blood turn into acid in a way, and then the patient becomes so sick from this that they go into a coma. Sometimes we put them in the ICU and we take him out of that coma over 24, 48 hours, but it's a pretty severe condition. So, some people have very varying complications of that. But here they recommend that you take patients of the oral anti-hypoglycemic um, substances or medications, that the medications that lower the blood sugar, by medications, the oral agents, the oral anti-hyperglycemics like metformin or any other of the orals, that you take them off and you just manage the patients with insulin. That way you can keep track. A lot of times we end up doing this in the ICU anyways, because it's easier to put an insulin drip or to really check the sugar every couple hours and give the patient exactly what they need. And this is so important to actually keep these patients alive in the ICU. They shows that they have better outcomes when you do that. Now, they also talk in these studies about the unproven therapies. Remember, it doesn't matter what politicians are saying. It doesn't matter how optimistic we are. That's the brutal part of medicine sometimes for me, because I am an optimist, and I really believe that the more optimism, actually, studies show different things, that when you're really looking at the best side of things, actually people tend to do better, entrepreneurs tend to do better. There is all these markers that show that. A lot of times in medicine is brutal, because you have to be very factual, and a lot of these therapies, even if the politicians or somebody saying that they're optimistic about it, yes, we are, but we have to be very clear that none of these are actually proven therapies. And remember, the third leading cause of death in the US is from medications and procedures. So just remember that, like, that is a big problem, and this is why that's a problem, because as soon as people say like this medication could work, then every patient is asking us for this medication. But we know that a lot of times when we give medications, we can kill patients with medications. So we have to be very mindful that a drug has to be studied for years before we can give it, because we can cause more harm than we cause good. And remember the Hippocratic Oath: do no harm, do no harm. So in summary, remember that type 2 diabetics are more likely to die from death, 3 times more likely, right? About 1 to 3 times more likely. Most of the studies show about 2 to 3 times more likely. Those are the bad news, but the good news is that you can do something about it, and that 86% of the patients can reverse the type 2 diabetes. That's the main thing. Second thing, how do people from diabetes die? They die from complications in their small vessels, complications in their large vessels. Complications in their small vessels is like diabetic nephropathy, and all, some of these issues. And then the microvascular ones, the main ones are heart and liver disease, heart disease, liver disease, and peripheral vascular disease. Those are the main micro small vessel complications and macro large vessel complications. That's how people die of type 2 diabetes. And why is it important with COVID-19? Because COVID-19 just acts as another agent that is putting stress on the system. And if the system is already stressed out with type 2 diabetes, then you're just adding a load into it. So what is the best thing you can do if you have type 2 diabetes? To start looking into ideas and ways that have been proven scientifically to reverse type 2 diabetes, which can be done in about 86% of the people. So the COVID-19 just surfaces something that we already knew, that people are the most vulnerable, is the weakest link. People with type 2 diabetes and heart disease are the weakest link in the chain. So what does that mean? What does that mean? That if they're older, we need to protect them. And if they're not, and it's us, we need to, if that's something that we care about, to get on top of it and get rid of it, because we can get rid of it. Type 2 diabetes can be reversed and cardiovascular disease can be reversed. And a lot of this data has been shown over the past 15 to 20 years, mainly on cardiovascular disease and how it can be reversed for many people. And then for type 2 diabetes, how it can be reversed has been coming out probably in the past 5 to 7 years. A lot of good studies that show that about 86% of the people can reverse it. Dr. Zuleta here. If you like this video, share it to people that you know that can hear this information and be benefited from it. Share it so other people can hear it. If you're a doctor or a healthcare practitioner, share it so that other doctors can hear it. And if you have questions or suggestions or anything that you want me to do these videos on, comment right below and we'll get to it. All right, Dr. Z here. Stay safe. Much love to everybody. Much strength and take it easy.